Testimony. We now proceed to the Q&A sessions, questions and answers, and we'll start out with Mr. Smith.
Thank you, Mr. Chairman. Thank you to all of our witnesses. I'm tempted to go in a different direction than what I have here. Maybe if I have time, I'll do that based on the last few comments. But I think we all know that our task is large. When you look at chronic diseases, I mean, just on the numbers, over 800,000 Americans are living with end-stage renal disease, 38 million with some form of diabetes, 120 million Americans, nearly 1 out of every 2 adults with hypertension. And these diseases obviously impact all of us, either directly or certainly through family members. So treating these conditions are expensive, as we know, and neglecting them is even worse and even more expensive. So I hope that we can really take a close look at how we can address healthcare, hopefully bending the cost curve, not just shifting around who pays how much. We've been doing that since 2010, I think it is, and throwing money at the wall, hoping it'll help someone with disregard to so many other things, certainly is not what I think our task should be. But when we look at our trained professionals, and Mrs. Reichert, thank you for being here. Excuse me, I'm a particular fan of pharmacists and the opportunity we have to tap into their ability, not just in rural America, that it might be my district, but even urban communities where we know that there's more access to pharmacists than there are other providers. And I think, whether it's pharmacists, physician's assistants, nurse practitioners, nurse anesthetists, EMTs, and even others, I think we can adjust our policy to meet the maximum opportunity of these professionals who can help care for patients. And I think we can do so in a very constructive way, ensuring that patients have safety along the way, and that our patients can be better off. But I'm particularly proud of my legislation. Thank you, Mrs. Reichert, for mentioning it. The Ensuring Community Access to Pharmacy Services Act, we call it ECAPS. And this is something that I think is particularly important to offer patients more options. We already offer Medicaid patients and a lot of commercial pay patients this opportunity for treatment, testing and treatment from pharmacists, but not Medicare. And we know that we've got a large portion of patients under Medicare that we want to help. So I do have a couple questions, Mrs. Reichert, and again, thank you for being here. As you know, care coordination is essential for managing both acute and chronic health problems. In a state where a pharmacist would be able to test and treat for a disease like COVID or influenza, how would the pharmacist be able to inform the patient's primary care provider about the encounter?
Thank you for the question, and thank you for the bill. So in our current practice with collaboration with providers and test to treat, our current form of communication is largely via telephone. And so I think that as we move forward, enhanced interoperability would really be something that could help benefit not only the pharmacist-provider relationship, but also our patients in providing quicker outcomes for them. Pharmacists work daily in collaboration with providers. This is something that's been a cornerstone of the pharmacy profession for as long as I can remember, but it is, our communications are often largely, prohibitive to telephones, and so waiting for a call back or, that sort of thing. So enhanced interoperability is something that I think could really provide better outcomes for our patients.
Very good, thank you. Now, I appreciated your reflection on your relationships with your patients. That's pretty unique to community pharmacies. We also know that community pharmacies across the country have suffered. Many have closed, especially in rural areas. Can you maybe expand on how the ECAPS bill could enhance opportunities for pharmacists to maintain practices all across the country?
Yes, thank you. In my home state in Illinois, in 2024, we lost over 100 pharmacies, and to me, that number is staggering. So legislation like ECAPS helps to preserve the care for those patients who need it most. So shifting the care from emergency rooms to community-based settings to more accessible settings for those patients really helps to preserve that care and helps to preserve the pharmacies in that area.
All right, thank you. My time has expired. Thank you, Mr. Chairman.
Thank you.